In front of us we have a clavicle. We can tell whether or not it's a left or right clavicle when the acromion process is in the correct place. It should make a frowny face. If we were to try and reverse it, we currently know this is a right one. See how it makes a smiley face? We want it to be a frowny face. This is the acromial process. This is the sternal process. This is the sternal side because it connects to the sternum. It's also known as the medial end. Underneath the lateral end over here, we have a large series of bumps, which is a secondary way of telling this is a right clavicle. Next, moving on, we are going to discuss parts of the scapula. Right here is the medial border. Over here is the lateral border underneath the glenoid fossa. Here, along here is the spine. Here is the coracoid process. Up here is the acromion process, which the clavicle connects to. This is the subscapular fossa. Excuse me. This is the infraspinatus fossa. This is the supraspinatus fossa. And down here is the subscapular fossa. Moving on, we're going to talk about parts of a humerus. This is a right humerus. This is a left humerus. We can tell that because the head right here points to the right or towards the midline or medial end, as well as the medial epicondyle is up here, which allows us to determine that this is a left humerus. Now, up at the top is the head. Directly beneath the head, where this is rolling across, is the anatomical neck. This is the lesser tubercle. This is the greater tubercle. In between the two of those is a interturbicular groove, which is where the deltoid tuberosity runs through. And we can see where it connects along here as we see the series of ridges or bumps and striations. Along this small pink line, we can see the surgical neck, because the humerus doesn't break exactly on this anatomical neck up here. It mostly breaks along here. It has gained the name surgical neck. If we look down here, we have the medial epicondyle, and we can tell it's the medial because it's always larger than the lateral epicondyle over here. The next thing we're going to talk about is parts of a radius. This is the radius here. The head of the radius is right here. This is the neck of the radius directly underneath it. This is, let's find it. This is the radiotuberosity, this small piece right here. And then at the very back, we can find the styloid process, which points to our thumb. And as we can tell, if I was to lay my thumb down here, this styloid process points to my thumb. Therefore, we know it's a left radius. Next part, we are going to talk about the ulna. So right here is the trochlear notch. This big valley right here is what connects to the humerus. It prevents us from overextending our elbow. Next, this small piece right here is the radial notch. It allows us to twist and supinate. Moving on, this is the olecranon process, this part in the back, which makes up our elbow. This has a styloid process as well, but it's only this small piece right here. And we know that this is a right ulna because the trochlear notch, or no, this is a left ulna because it has space for the radial notch on its left side, which means that whenever the radius supinates, it will be rotating upwards, rolling the hand across, and sitting on top of, in an X formation, over the ulna. Moving on, we are going to talk about parts of the hand. This is a right hand. The hand, or the thumb, or pollex, is on the, or actually this is a hallux. I'm going to go with pollex, that sounds more correct. Excuse me. This large piece here is the scaphoid. This hammerhead style entity is the hamate. This tiny bone is the pisiform. And then this one connecting our thumb is the trapezium. We're going to talk about the different kinds of carpals. These are the metacarpals. These are the small individual pieces that help connect to the bone. Then we have the proximal phalanges, the middle phalanges, which are these secondary bones, and then the distal phalanx. Finally, the thumb is different from these because it does not have a middle phalange. It has a proximal and a distal phalange. Moving on, we have a left patella. We can tell because when we set it up forward, the pubis is right here, and the acetabulum is facing away and towards the left. This is the anterior superior iliac spine. This is the anterior inferior celiac spine. This right here is the posterior superior iliac spine. This is the posterior inferior celiac spine. This is the obturator foramen. This, on the back where we like to sit, is the ischial tuberosity. Up here is the ischial crest up on top. Moving on, we're going to talk about a femur. A femur, also known as the thigh bone. This is a left femur. We can tell because the head points in to the medial. The head is currently pointing towards the sternum, and as well we have the medial condyle here is much larger than its lateral condyle, which clearly indicates that this is a left femur. Up here, the femur is special as it is the only bone in the body to have a trochanter, and a trochanter is similar to a tubercle, but it's this is the greater trochanter, this big projection. This is the lesser trochanter. This is the neck of the femur. The linear aspera is this long indention that we can see running up the back of the femur. Let's see if there's anything that I missed. Oh, almost forgot. The gluteal tuberosity, which is this rough point up in here, not to be confused with the linear aspera, is where our quads like to run through. Down here, we're going to take a look. These are the condyle. These are the epicondyles, and these are the condyles. This one is the lateral. This one is medial. This is the medial epicondyle. This is the lateral epicondyle. This is a patella. This is the knee bone, and we can tell that this is a right patella simply because when it has this nice smooth shape and it doesn't have these deep or steep ridges, we can set it down pointing away from us like an arrow, and whenever we just drop it, it will fall to the side that it belongs to. So we're going to set this down, falls to the right, it is a right patella. Moving on to the tibia. This is the lateral condyle. We can tell that because it is the smaller of the two condyles. This is the medial epicondyle, condyle. We can also tell that because because underneath the medial condyle is the medial malleolus. If we take a look inside, right here is the tibial tuberosity, where all those rough spots are. Next up, we have a right tibula. This is the lateral malleolus. This is the head of the fibula, and we can tell that because this points to the pinky toe. And if we were to align it with this with a left tibia, this would be connected to the bottom and almost hanging, while this connected to a shallow piece on the bone. The final one we have moving on is the foot. This is a right foot. We can tell because the big toe is always medial. This is the calcaneus. This is the part of your foot you strike when you do a heel kick. This is the talus. This small boat-shaped one up here is the navicular. Then we have metacarpals, similar to the these are metatarsals because tarsal is part of the foot. This is 1, 2, 3, 4, 5. Then we have the proximal, the medial, and then the distal phalanges. Again, the big toe, or again, the big muscle, the hallux, does not have a medial phalange. There we go. That concludes the bone video.